Hi guys, today we're going to talk about head injuries and balance. So when it comes to balance, it might seem pretty simplistic in nature. Can you or can you not balance? Well, in reality, it's a lot more complex than that. There are three main systems that we have to think about when we're looking at balance. We have to look at your eyes. Are your eyes functioning properly? Are there difficulties with stabilizing them? Are we seeing some nystagmus jerks in there? Then we have to look at your vestibular system in terms of inner ear mechanics. Your vestibular system is really what gives your head the coordination of, or the input of, where your head is relative to the space around it. And the last system that we're looking at is called your proprioception, which is really your body's way of communicating to your brain where your limbs are with regards to the space around them. So we're kind of looking a little bit more at the joint position sense of ground going up. After we look at those three systems, we're really looking at the integration within the brain itself. So when it comes to balance, you can have an issue with one of those systems, or you can have an issue with either a combination, or potentially, if you're doing really poorly, you can have an issue with all three of those systems. So when it comes to balance, you can see it can be quite complex right off the get-go. The more adept you are at analyzing those systems and really determining is there a fault with one of them or not allows you to kind of prepare a better rehab pattern or treatment schedule, if you will, that will appropriately rehab that patient. So when you're looking at balance, you can look at balance both feet together. You can look at balance one foot in front of the other in a tandem position. Those two systems might help you determine a little bit of a difference between when the person is kind of separating their base a little bit, so you're looking a little bit less at proprioceptive feedback compared to when you're making their base a little bit smaller. Other things that you can do to kind of determine the differences with balance is potentially having a different head position. Whether the head is placed over to the left or whether the head is placed over to the right, you're going to have a different bias on different vestibular systems, which is going to either give you an improvement in your balance scores, or it'll show kind of a little bit more of a flaw. When it comes to the eyes themselves, in terms of determining if they're working properly, well, that one's a little bit more tricky. Sometimes when people have big flaws, you can see little nystagmus jerks, little kind of shakiness within the eye themselves just by looking at the patient at bedside. Some other times it requires a little bit more advanced technology in terms of really differentiating. Maybe that patient has some gaze stability issues, maybe they have little flutters that are kind of setting in there. So if you have something kind of like a VNG, VOG, which is essentially a diagnostic tool that helps you look at the patient's eyes, and it helps you track them either in darkness or while they're monitoring different objects, that can really dictate or determine whether the patient has problems within that system itself. Once you figure out where the faults are, it allows you to kind of work on and rehabbing those systems. So there you have it. That's one of the reasons why balance can be very, very, very important in terms of rehabilitation, because there's a lot of different facets to come in place there. That's also one of the reasons why a lot of people who have head injuries will have problems with balance, because there's multiple different mechanisms that could go wrong in order for you to have those kind of subtle differences with your stability. Either way, it's always good to look at your balance and make sure that it's maintained. And sometimes it can be used as an indicator to see how well you're doing within your recovery itself.